My name is Stephanie Barnett Harrow. I am the Older Adult System of Care Coordinator for Clackamas County Behavioral Health.
So what does that mean?
Part of my job is to look at the different systems that are at play to providing services and support to older adults within Clackamas County. So sometimes that means helping systems talk to one another and getting people in touch with resources. Sometimes that means consulting on cases where things may be a little more challenging or a little less clear than they may be with others. But it really is a position where I'm bridging the gaps between the systems as best as I can.
If you're somebody who has a loved one you think is declining mentally, what should you do?
There are several options depending on how severe the situation may be. All three of the counties in the region have a crisis line that people can call if they think somebody is in crisis. If people are concerned about something like Alzheimer's or dementia, the Alzheimer's Association has a 1-800 line that's free for families across the country to call and maybe talk to somebody there to find out if there are warning signs that are related to Alzheimer's disease or other dementias. And then also our county and the two regional counties, Washington and Multnomah County, have classes for community members at a website called gettrainedtohelp.com to help people recognize when somebody may be in mental health crisis and or at risk for suicide.
Being a family member in this position is one of the most difficult things there is, right?
Absolutely. It can be really challenging to see your loved one change so significantly in the way people can when they have a dementia or are in some sort of mental health crisis.
Sitting from your position, what do you think people should know?
I think if people are concerned of somebody being in crisis at this moment, to call the crisis line in their specific county is a really good first step. I think if it's something that people are seeing sort of a gradual change in their loved one, talking to the person's primary care physician is a really good place to start. Like I said, calling for Alzheimer's Association help if people think that's what might be going on is a good place and a good resource for families. And making sure that you're talking about it with doctors, and really keeping all of the care partners in play for the individual. There is help available for families. There's a lot of education and support for families who are looking for extra help in helping their loved one manage and navigate through the healthcare systems.
Can it be a long process?
It can be a very long process. Sometimes these things can go on for years. Hopefully families are able to get the supports that they need to help themselves manage what's happening. But things like Alzheimer's and dementia can be anywhere from 10 to 20, sometimes 30 years, depending on how young the person was when they got the disease.